So there really is this paradox about the spread of proven innovations in health and care. So if we take statins, we did our first trials of statins in the 1980s. We started prescribing them in the NHS in the early 1990s. By the end of the 1990s, we were delivering 1 billion daily doses of statins, dramatic reductions in death from cardiovascular disease. And then you take Joseph Lister's wonderful research on antiseptic methods. Way back in the 1850s, first Lancet publication in 1857. He laid the basis for modern surgery. But just a few years ago, NICE was still writing papers exhorting doctors and nurses in the NHS to follow proper hand-washing procedures. So there are some innovations that spread like wildfire, and there are other innovations that are just stubbornly immobile, even if they are really easy to spread, and even if the evidence base is absolutely clear. So when we really struggle to fix a problem, and I think we're really struggling to fix this problem of adoption and spread, management theorists and anthropologists suggest that we re-examine those mental models, those paradigms that we hold in our minds. And we all know a little bit of the story of how McDonald's spread its empire. They built whole walls and roofs, and they put them on trucks, shipped them across America, bolted them together on greenfield sites. They codified exactly what was happening in the restaurants and wrote manuals, and they trained the staff to follow the formula precisely, right down to how many seconds before they flipped the burgers. That's the dominant model of spread in developed economies, but it doesn't seem to be working in healthcare. In healthcare, when it comes to spreading complex service change, introduction of complex technologies, we can't simply write protocol standards, manuals, and tell people to do things. We need much, much more sophisticated change processes. So we need social movements. We need to examine the underlying philosophy, the cultural factors that make a technology successful or unsuccessful. And we need, big collaborative movements to make these changes properly. So we have a wonderful track record, both in innovation and in the transmission of some innovations in the NHS. I'm starting to learn about what's happening in other European countries. There are really interesting things happening in countries like Denmark and Finland in terms of how innovators, public services, and the public work together to design innovations, not just to get feedback or tests, but constant involvement from the public in the development of innovation. We really need to get to some of those secrets.